Okay, so I am Lisa Mulvihill, and I'm a psych services consultant at the school board. This is my colleague.
I'm Laura Bickle, also Psych Services Consultant at the board.
So today we're going to talk to you about an assessment. What is a psych assessment? How do we understand it and make sense of all the pages of information that you get? We just wanted you to know that we're going to offer general information. We can't get into interpretation of an individual child's assessment. If you have questions about the assessment, please contact the person who did it. We spend a lot of time thinking about the results of the assessment, and then we do an hour feedback and hope that everybody gets all the pieces. So if you've read through it and you've done the feedback with the psych person and you still have questions, please contact them, because I'm sure they'd be happy to go through it with you. Okay. So what are we going to do today? So we're hoping, we always plan too much, I think, in this short lunch and learn, but we'll see what we can do. So we're going to talk about what a psych assessment is, how your child is referred for an assessment through the various ways that you can get a psych assessment, some common tests and terms, and how they might apply to your kiddo in real life, what these numbers mean that you get sometimes in charts and in reports, and what to do after the assessment's completed. So that's a lofty goal. All right. You want to start with this, Laura?
Yeah, sure. So we'll start with who can do a psychological assessment. There's lots of confusion out there about who's a psychologist, who's a psychiatrist, who's a psych associate, who's a therapist, so there's lots of confusion about that. My own mother still calls me a psychiatrist, even though I'm so we just thought we would demystify that. So folks that can diagnose mental health and learning intellectual difficulties are psychologists. Psychologists are registered at PhD level, and psych associates that are registered as master's level clinicians. So these are folks that are registered with the College of Psychologists of Ontario. And so we can diagnose mental health difficulties. We can diagnose neurodevelopmental disorders such as ASD, that's autism spectrum disorder, learning disabilities, ADHD, intellectual disabilities. We can also diagnose things like depression, anxiety, those kinds of things. Folks that cannot diagnose are counselors, therapists, psychotherapists. So basically anybody that's not registered with the College of Psychologists of Ontario cannot diagnose. Okay. So let me just scroll down here.
So can I clarify that? So when you say can't diagnose, like learning and intellectual disabilities, but like physicians and psychiatrists can diagnose mental health, right?
Yes. Sorry, I should have
No,
mentioned
that's okay. That's why we're here. It's to help each other.
So people that are registered with the College of Psychologists, and then people that are registered with the College of Physicians and Surgeons have access to the controlled active diagnosis.
And just letting one more person in.
Yeah. And psychiatrists, to clarify as well, the difference between a psychiatrist and a psychologist. Psychiatrists are medical doctors who certainly do provide diagnoses, but also provide medication. So we, with the College of Psychologists of Ontario, we are not medical doctors, so we do not prescribe medication. So that's kind of the big difference there.
Got it.
Yeah. All right. Why might my child benefit from a psychological assessment? So really what a psychological assessment is designed to do, and another term that people sometimes use that you'll hear is psychoeducational assessment, we're really trying to get a picture of your child's unique profile of learning strengths and needs. So we're going to look developmentally at your child across a whole bunch of different areas. So we're going to look at their cognitive abilities. So their thinking, reasoning, problem solving skills. We're going to look at their learning abilities. We're going to look at their memory. We're going to look at their information processing. We're going to look at their academics. If there are socio-emotional and behavioral concerns, we're going to look at that end of things as well to see, where are they at developmentally in terms of their social development, their emotional regulation, attentional regulation, etc. So it's a very comprehensive picture of who your child is. Like I said, their unique profile of strengths and needs, which everyone has a unique profile of strengths and needs. This is particularly the case. People typically seek out a psychological assessment when they're noticing that the child is having some challenges relative to their peers. So typically it's in response to a child having some degree of struggle to some extent in any of those kind of areas of development that I just mentioned. So that's kind of what a psych assessment is. And then I'll turn it back over to you, Lisa.
Okay, so Laura mentioned some of these. So we look at intellectual ability, processing speed or processing skills too, academics, so reading, writing, math, memory, so rote memory, as well as working memory, which is the ability to hold information kind of online and maybe organize it. So when you think about working memory, it can be really important in written work, right? You have to organize what you want to say and then write it down. Mental math is another example of working memory. What are their social skills like? Life skills are really those skills that allow people to carry on in life, go out in the community and be safe, communicate with others, do household tasks and chores and things like that. And then mental health is one puzzle piece, but it really can be many puzzle pieces: anxiety, depression, those kinds of things. And we look at all kinds of mental health issues when we're doing a full comprehensive psychological assessment. Okay, and it really is sort of putting the puzzles together to glean understanding from what's going on. So what do we do? What do we do? What are the steps in getting a psych assessment? And that really depends on where you're looking for a psychological assessment. I'm going to start with private first on the right-hand side of the chart. So there are psychologists and psychological associates in private practice. This is not covered by OHIP, and it is covered either by your benefits through your employment, or people also pay out of pocket. There are some agencies that have a sliding scale, so it might be less depending on people's income or benefits or whatever. And we put a link in there to help people find a psychologist in private practice. On the left-hand side, public, there can be a number of different ways to get an assessment. It can happen through hospital, like Grand River Hospital, for example. Some community agencies also offer psychological assessments, and the school board, which is where we live. And so how it works, the school board, really briefly, is there are a number of assessments. We meet with our schools monthly and try our very best to be equitable and fair in choosing students who could really use an assessment. It's not easy because there are lots of kids who could benefit from an assessment, but usually kids are referred because interventions have been tried at the school level and kids are still struggling academically, socially, mental health, etc. Parents do not pay for these assessments, which is really a bonus, especially, if you don't have benefits, or benefits don't cover the whole cost of an assessment privately. Anything to add, Laura?
I would just add to that. I mean, the other nice thing about if you are able to get an assessment at the school is you're not having to schlep a kid back and forth to appointments, which can be nice. So it all happens at the school. There's a certain richness of information that we're able to access within the school board. So we're able to look at your kiddo's OSR. So we're able to really review all those previous report cards and any documents that are in that file. We're able to see. If you get an assessment done privately, you will often find that the person will ask you for copies of report cards and so on, just so they can get that school history piece of things. And Lisa, are we going to share this slideshow with our participants?
Yeah, at the end, we'll stop recording and we'll talk about how we're going to get the slides to people. Yeah,
because I'm just thinking that link there might be helpful.
Exactly. Okay, great.
All right, so common tests and terms. So we love acronyms in psychology. We love lingo. We love jargon. And I know, those of us that have been doing this for a long time, and Lisa and I both fall in that category, 20 plus years. We've tried over time to demystify our language to make these reports more accessible for parents. So here's some of the, so under that, you remember those puzzle pieces that we showed earlier, one of those puzzle pieces was intellectual ability. So intellectual ability really looks at kind of the power under the hood, sort of how we learn, the capacities that we are sort of inherently born with. And we look at a variety of different elements of intellectual ability, and we break them down into various ways so that we can understand, again, those kind of strengths and areas of need. So we look at a person's verbal thinking skills. So that's kind of higher order thinking and reasoning with language. We look at higher order thinking and reasoning in more nonverbal or visual spatial ways. And we often find that there's big differences there for kids. You know, we have people that are definitely more astute verbally than they are in terms of hands-on visual spatial. We also look at things like working memory processing speed. These are sometimes described as kind of lower order or clerical skills. So we want to see how well those skills can sort of shore up those higher order thinking skills. You'll hear lots of test names if your child has had or is getting an assessment. They're typically, there's a lot of tests that have the name Wechsler in them. So Wechsler Intelligence Scale for Children is the one that's referenced here. Wechsler Adult Intelligence Scale is the other one. So the Wechsler scales are kind of the industry gold standard, if you will, in terms of assessing cognitive ability. Yeah, go ahead, Lisa.
Okay, sorry. So academics is what we've learned, you know, what we've learned in school. And basically you'll see different ones here. An example is the Wyatt 3, and we just got the new Wyatt 4 edition out. So you might see that coming soon. There's also something called the Woodcock-Johnson that some people might use, but generally, well, they're both used, but I think typically at the school board, most of us are using the Wyatt 3 and soon the Wyatt 4. So we look at the basic reading, writing, and arithmetic. And we look at reading words and non-words, reading little passages, and understanding what you've read. Writing is spelling, sentences, paragraphs. Creating sentences will be done a little bit differently on the Wyatt 4 in terms of how quickly you can do that. And arithmetic looks at sort of your basic math facts, word problems, things like interpreting graphs or, you know, working with money or geometry, those kinds of things. We can also look at how quickly your math facts are remembered. And it's important to say that we read the math word problems to kiddos so that it's not confounded with their reading skills. Okay, so basic reading, writing, arithmetic. And do you want me to keep going?
Yep.
Okay. Other common tests are, okay, phonological processing. And one thing I do want to say is we use this language like it's everyday language, and it might be well known to some people, and it might be the first time you're hearing it. Please don't feel silly or embarrassed or whatever to say, what the heck is that? Because I think it's really important if we forget that we're using this language that we're reminded. So phonological process is extremely helpful. It's the building blocks to learning how to read. It's the oral language part of learning to read, the knowledge of letter sounds and parts of sounds of words. We need this for reading, but also for spelling. And one of the common tests you might see is called the CTOP 2. Okay. Memory, so short-term, long-term memory, recognition through multiple choice. We look at verbal and often visual memory as well. And the two tests that are fairly typical are listed below there. Visual motor integration, another fancy way of saying what we see coordinated with what we draw or what we print. So basically, there are many kids who struggle with their fine motor skills, and it makes printing really difficult. So one of the things in our job is sometimes we get layers of issues. You know, we get working memory, so it's hard to think about what you want to say. And then you have fine motor. It's hard to get your pencil or pen to do what you want it to do. So that's why we look at all these different things, because kids in particular who have a number of these processing kind of issues or fine motor issues, you can see why certain tasks would be really onerous for them. And executive functioning. Some of the examples are below of what we use. And executive functioning is really your executive assistant, if you will, in your brain. Skills that you need to plan, organize, think before you do something, monitor your own behavior, initiate tasks, transition from task to task, manage your emotions, all those things that your frontal lobe here does. Super important part of managing every day in school and in life. Okay. Want to do this?
All right. Yeah, sure. I'll do this one. So then we're moving on to kind of the social emotional part of things. So how do we go about looking at that? It's a fairly complex process, so it's not sort of a one piece of data that drives our understanding. We look at a whole bunch of different things. So we'll often have parents, teachers, and even the student themselves, if they're a little bit older, do some questionnaires. And those questionnaires provide us with sort of a quantifiable um, element to looking at sort of their social and emotional development. So seeing, relative to other kids their age, how are they doing in areas like emotional regulation, attention, etc.? Are there things that are coming out as areas of concern? We, of course, always do interviews with parents. That's a critical component. Sometimes we'll interview teachers. Sometimes we'll just kind of access that information more from questionnaires and the report card review. Um, we are able to look at a variety of different things, as we've kind of chatted about already: anxiety, depression, social difficulties, ADHD, behavior, autism spectrum disorder. And then at the bottom, we've listed some of the questionnaires that you might see if you are being asked to complete those for your kiddo.
And one of the things that we really need to say in understanding the numbers is that all of these assessment tools that we use are normed. They are given to a whole bunch of kiddos, and then we can compare how our student is doing compared to other kids their same age. So when your kiddo was born, and they might have said, oh, they're at the 50th percentile for weight. That means that half the kids were bigger and half the kids were smaller. So we're going to show you. So imagine if we lined up 100 kids and someone fell at the 20th percentile. That means that they scored the same or higher than 20 of those kids and not as high as 80. So it's not a percent like you get on a test. It's not like, oh, you got 75% or 25%. It's a percentile that talks about where you fall in line relative to the other kids your same age. So it would be sort of like this picture. There's 100 people at the 20th percentile, the blue ones. You are doing better or the same as those kids, and the other kids are doing better than that. Okay, does that make sense?
And we
So
look at and the average rate, there's a range of average, right? So it's not like the only average point is if you're at the 50th percentile. There's a range. So we look at anywhere from the 25th to the 75th as being average. Things that are below the 25th are things that we know are perhaps more problematic for that particular child. Things that are above the 75th percentile are things that we know that they're really excelling in.
yeah, perfect.
All right.
Okay. So you're going to get recommendations. And sometimes you get a lot of recommendations. And what I think a number of us are trying to do in our reports is kind of highlight the ones for follow-up first and then give some recommendations. The expectation is not that you run out in the next week and get all the recommendations done. That wouldn't be possible. But we have to take it one step at a time. And sometimes a good idea is to read through all the recommendations in the report and highlight the ones that you think, or you and the psych person who did the assessment, are the most important. Clarify if you're confused. I know sometimes it's hard to ask questions, but please do so. Even if you give it a few days, you read the assessment, like I said before, please do ask questions and follow up with the person who did the assessment. We don't just see your kid and then whip off a report in an hour. We have to score it and think about it and formulate. And so it's not surprising that people would have questions after an hour feedback. We always talk about sharing the report with school, physician, therapist, so that people can work together with the best knowledge that we have about the student or the kiddo. Sometimes, particularly in private practice, if we get into more personal information that you feel that you don't want to have in a report that's going to go into your child's Ontario school record, student record, then we can talk about taking out some of that personal information if it's not really crucial to the formulation of the report. Sometimes we make referrals. Sometimes it's to speech and language pathologists. Sometimes it's to occupational therapists. Sometimes it's for different kinds of therapy. Sometimes if kids have autism spectrum disorder or an intellectual disability, they can be referred to a community agency called Sunbeam, and we can help you with those referrals. If your child already has an IEP, the new information is incorporated into the IEP. If they don't, and some of the information suggests that an IEP, an individual education plan, another acronym, is necessary, then the school would talk about it and communicate with parents as to whether that's going to be necessary.